Welcome to Logical Ayurveda. Today, let us learn about Pithaja Grahani. So, unlike Kaphaja Grahani, the Pithaja Grahani has exact opposite Nidanas of Kaphaja Grahani. That is, it comes because of excessive intake of Ushna Ahara, Kattu Ahara, Amla Ahara, and Lavana Ahara. What are those? As a practical example, we go to a hotel, order a tomato soup, followed by Szechuan spicy noodles, and followed by having mushroom tikka or chicken tikka as a side dish. We take excessive amla, tomato soup, excessive shara, vinegar that is present in fried rice, excessive spices, kattu ahara, oil fried that is heavy to digest. All these foods that definitely lead to Pithaja Grahani. So, what are the basic symptoms, trivial symptoms of Pithaja Grahani? Or in any Pitta we have Hrit Kanta Daha, burning sensation in epigastrium. That is a main symptom. But the cardinal symptom of Pithaja Grahani, I told you the cardinal symptom of Kaphaja Grahani is repeated stools with normal consistency but no satisfaction. Stools are mixed with mucus and phlegm. That is a cardinal symptom, that is a main symptom of Kaphaja Grahani. Whereas main symptom of Pithaja Grahani is repeated stools that are yellowish in color and mixed with blood. Either it is mixed with blood and there are repeated stools and it is associated with excessive burning sensation. Number one, they have to go to the toilet again and again. The stools are yellow in color or it is mixed with blood and excessive burning sensation is present. Now, whichever is mixed with blood, that is that aspect is of Pithaja Grahani is ulcerative colitis. I will discuss ulcerative colitis in detail in some other topic, but for now I will discuss basic Pithaja Grahani Lakshanas and treatment. What is the treatment of Pithaja Grahani? Treatment of Pithaja Grahani, we have Samanya Aushadhis that I use in everything like Dadimastaka Churnam and Madhifala Rasayanam. Can be used in Pithaja Grahani also, but some patients find Madhifala Rasayana to be extremely amla and increasing the burning sensation in the stomach. For such patients, I cancel Madhifala Rasayana. I won't cancel initially in the first prescription, but if they are not adaptive to Madhifala Rasayana, if they find that Madhifala Rasayana increases, sir, if I take 2 cups of 10 ml of Madhifala Rasayana, immediately my burning sensation starts. Immediately I feel irritated. For such patients, I do not prescribe Madhifala Rasayana. So, main prescription in Pithaja Grahani will be finding a Tikta Kashaya or a Madhura Kashaya. Number 1, Gulichadi Kashayam, that is Tikta Pachana. Vasa Gulichadi Kashayam, that is Tikta Pachadi. Gulichadi is useful when the patient is having stools that are mixed with the blood. Vasa Gulichadi Kashayam is very useful when the stools are mixed with both the mucus and the blood. And Drakshadi Kashayam, I mix Gulichadi Kashayam plus Drakshadi Kashayam in case the patient has bleeding and the patient also has vertigo. The patient also has vertigo and bleeding, they both together. See, the beauty of Gulichadi Kashayam and Drakshadi Kashayam is you have Gulichadi Kashayam that is Tikta and Ruksha. So, giving long-standing Gulichadi Kashayam, which is Tikta and Ruksha, increases Vata. Ruksha increases Vata. Tikta Rasa increases Vata. So, we need to, it is debilitating to the patient. You continuously give Kashayas like Vasa Gulichadi or Gulichadi Kashayams. It is very Ruksha and debilitating to the patient. To balance that for a longer term, because it takes, this Pithaja Grahani treatment takes longer term, you need to mix it with Madhura Kashaya like Drakshadi Kashayam or Bala Punanavadi Kashayam or Bala Gulichadi Kashayam, etc. You should mix this both. So, Tikta we have to balance with Madhura Rasa. Something debilitating should be balanced with something rejuvenating. And Mahatiktaka Kashayam I use. Mahatiktaka Kashayam and Mahatiktaka Gridam. I either mix Gulichadi Kashayam or Magatiktam Kashayam and Gulichadi Kashayam and Mahatikta Gridam. Whenever there is excessive bleeding and the bleeding is not stopping with anything, the only thing that to stop the bleeding in ulcerative colitis is Mahatiktakam Kashayam mixed with Gulichadi Kashayam or Mahatiktaka Gridam mixed with Gulichadi Kashayam is an excellent choice of prescription to stop the patient's bleeding. And that I understood while practicing. So at the end of the treatment, you can prescribe Gulichadi Kashayam along with Dadimadikritam when the patient has a lot of tiredness, etc. You can prescribe Gulichadi Kashayam and Dadimadikritam. Dadimadikritam specifically, I prescribe in Mudavada Anulomanam for achieving Mudavada Anulomanam, for relieving of Admana, etc. And in such cases, I prescribe Gulichadi Kashayam along with Dadimadikritam, but I don't use Dadimadikritam excessively. So, Dadi Mastaka Churnam along with Takra as a Samanya Aushadhi I give, Vilvadi Gulika as a Samanya Aushadhi I give, only Madhifala Rasayanam I give in initial prescription, but if the patient is not comfortable with the Madhifala Rasayanam, I definitely do not prescribe Madhifala Rasayanam, because basically Madhifala Rasayanam is Amla. So Amla increases Pitta.